Vaginal yeast infection, cause and symptoms. Vaginal yeast infections, also called Candida vaginal infections, typically are caused by the Candida albicans fungus. During a lifetime, 75% of all women are likely to have at least one vaginal Candida infection, and up to 45% have two or more. Women tend to be more likely to get vaginal yeast infections if their bodies are under stress from poor diet, lack of sleep, illness, or when they are pregnant or taking antibiotics. Women with immune-suppressing diseases such as diabetes and HIV infection also are at increased risk. Vaginal yeast infections are very common. They can bother you a lot, but they are simple to treat. The symptoms of a yeast infection, such as itching, can also be caused by other problems. If you have never had a yeast infection before, or if you are pregnant, see your doctor. If you have had a yeast infection before and recognize the symptoms, you do not need to see a doctor. How do I know if I have a yeast infection? Yeast infections can be very uncomfortable, but are usually not serious. Symptoms include the following: itching and burning in the vagina and around the vulva, the skin that surrounds your vagina. A white vaginal discharge that may look like cottage cheese. Pain during sexual intercourse. Swelling of the vulva. Symptoms. Common symptoms for all three infections include some kind of vaginal itching, redness, and a discharge. Below are all the yeast infection symptoms. Itching and burning in the vagina. Swelling, itching, and burning around the skin surrounding the vagina and vulva, even at the lightest contact. White thick vaginal discharge. Pain and discomfort during sexual intercourse. Burning sensation during and even after urination. Causes, incidence, and risk factors. Candida albicans is a widespread organism with worldwide distribution. It is normally found in small amounts in the vagina, the mouth, the digestive tract, and on the skin without causing disease or symptoms. Approximately 25% of women without disease symptoms have this organism present. Yeast infections are common among dishwashers and people whose hands are often in water, in children who suck their thumbs or fingers, and in people whose clothing retains body moisture. The diaper rash called candidodermatitis is caused by yeast growth in the folds of a baby's skin. Other yeast or fungal infections are balanitis, intertrigo, moniliasis, thrush, vulvovaginal candidiasis. Yeast infections or fungal growths usually develop in a moist environment, such as finger and toenails, folds of skin, genitals, webs of fingers and toes. Before looking at the home remedy for yeast infection, it is important to understand this infection. The fact is that most people are afraid of suffering from infections and end up complicating things further because of their fear and discomfort. Sometimes they tend to overlook the symptoms as they develop, hoping that a miracle will do away with the entire ailment. But this is not so. To begin at the very beginning, yeast infections primarily inflict women who are in the age group within which they can naturally bear a child.